Hi everyone, if you have foot drop or spinal stenosis, you're gonna wanna watch this video. I'm gonna show you what we do for foot drop, spinal stenosis. It comes from a disc herniation, pressing on the nerve, and or the spinal canal, which would be stenosis, spinal stenosis, central canal stenosis. So we've got Marcos here, all the way from Florida, who has foot drop, and we've treated him before, wow, like a year ago, I would say. He's back here in New York from Florida for a little while, and he's having a lot of neck pain, surprisingly, not just the foot and leg issue. But I'm going to show you how we treat people with foot drop. And then he was just complaining that his ankle doesn't dorsiflex as far on the right side, you said?
Yep.
So we're going to check that and just make sure that that's not a physical issue with the ankle. So if it is, I can adjust that like an anterior talus is what I'm thinking right away when he told me he couldn't dorsiflex. So if he's not able to, when I force his feet into flexion or his ankle, then I know that it's just a subluxated ankle and it's not his foot drop. Now you've had your foot drop on the right side, right? So it is the same leg as his foot drop. So chances are it is the foot drop. But we want to just double check and make sure it's not an ankle misalignment or a talus subluxation. And I've done some videos for you folks on talus adjustment, and I'll show you that as well. How are we doing here? Any leg pain here? Okay. So this is Cox flexion distraction technique. This is hands down the best technique, the gold standard when treating spinal stenosis or foot drop. Now, something I want to mention with foot drop. It's severe, and if somebody has foot drop and they're not improving with 3 times a week for 4 to 5 weeks, if that patient is not improving in 4 to 5 weeks, at least 40 to 50%, then they're probably going to need surgery. Okay, so luckily Marcos did have some relief. Close to 50% after a couple weeks. I don't even think we treated you for a few weeks, Marcos, because you weren't here that long. And of course, I'm not down in Florida to treat him. So, but just to give you folks an idea out there, if you have foot drop or spinal stenosis or a disc herniation or disc bulge, and you're getting treatment, and you're getting Cox treatment, you should see a 40 to 50% reduction in your symptoms within 4 to 5 weeks. If you're not seeing that, the doctor should refer you out. The chiropractor should refer you out at that point. And one of the ways you'll know that it's foot drop is your foot drops, meaning it's hard for you to lift your toes up towards your head like this. Okay, so what happens is when you walk, your toes drop down, and it's a very uncomfortable feeling. You almost feel like you're going to fall, right? So it's very difficult to walk, and I'm sure many of you have seen people when they're walking and they walk kind of like with their toe dropping down. That is foot drop. They most likely have a really bad back. Okay? Any pain down the leg here, Marcos? Good. Now, Marcos, since you have not been adjusted like this in a long time, you may be sore. Don't curse me out tonight, but when you wake up tomorrow, you're going to feel a lot better, okay? And now that we have you here for a couple days, I'll probably treat you tomorrow and Saturday while we have you here, okay? And are you doing the personal training stuff?
Yeah, still doing it.
Do you have a website up?
Not yet.
Not yet, okay. All right, so what I'm doing here is I'm going to adjust his sacrum, and we're going to push the sacrum down to open up the L5S1 space, the foramina, to give the nerves more room to breathe. without being chafed or irritated. Okay, and now what I'm going to do is, see here, I'm just doing flexion here. Now I'm going to press this pedal on the floor and we're going to distract the table out. So we're going to do traction with flexion. Let me know if you have any pain into the legs or numbness increasing into the legs, okay? You feel that release right there?
Just grab it.
Yeah, we got a really nice release from L4, L5, the sciatic nerve. Again, it's his first day back in a year or so, maybe more. I don't want to overdo it. I don't want you to be sore. But I do want you to stand up and see how that feels.
Stand up.
Yep. You should be able to stand up straighter, easier. How's that feel?
Much better, way amazing.
Okay, go ahead and reach forward, touch your toes. Okay, good. All right, great.
I was having a lot of, because of, you know, I was training for the race. I have a lot of pain in my lower back because I was running.
Okay.
And this is totally released.
Okay,
right
so your race, so he's here in New York for a, not just to see me, folks. He's here for a biathlon. And we need to make sure he's in tip-top shape for that biathlon. So we're going to make sure you're not even thinking about back pain when you run that race. Thanks for tuning in, folks. If you have any questions or comments, feel free to comment below and give me a thumbs up. I hope. Subscribe. We've got 4 videos coming out every week. If you have any questions or if you want to see a specific video, comment below. Thanks for tuning in.